Imagine that you and your employees are commuting to work by public transportation early on a Monday morning. Thousands of other people in your city also hurry to work and school. On this day, unknown to anyone at the time, terrorists have placed canisters of aerosolized anthrax in the subway system. Before the plot is uncovered, tens of thousands of people might have been exposed. Once officials realize the attack has taken place, it will take several days to pinpoint exactly who has been exposed. In the case of this type of large-scale public health emergency and many others like it, everyone in the community will need to receive medications quickly to prevent illness from the biological agent. In the case of an attack involving anthrax, that time frame would be less than 48 hours. Your local public health agency has been planning for just such a scenario. Working with state and federal officials, your local health department has been preparing to receive life-saving medications from the Strategic National Stockpile, the nation's cache of medications and medical supplies designed to be delivered during emergencies. If there is a biological crisis in your area, your state can request assets from the Strategic National Stockpile. Within hours of the request, these supplies will arrive in your community, and then it will be up to your local public health and emergency planners to get the necessary medications to everyone. In order to do this, public health officials have been preparing to open medication dispensing sites, sometimes called points of dispensing, or pods, in which the public will receive free medications that can keep them from becoming sick. These dispensing sites will likely be crowded, and your employees could spend hours away from their jobs obtaining medications for themselves and their family members. But you can help public health in this effort and protect your employees at the same time by signing your business up to become a closed dispensing site. While the community-based dispensing sites are considered open sites where anyone can receive the necessary medication, your dispensing site can be closed to the general public and accessible only to your employees or others whom you designate. By becoming a closed dispensing site, you will receive enough free medication from your local public health department to give to your employees and possibly their families at your facility. Your staff can dispense the medications so your employees will not need to report to community-based or open pods. Your local public health department will help you determine how your business will receive these medications. In addition, public health professionals will help you devise a plan to set up and run your dispensing site and help your company address some of the possible liability issues associated with this type of dispensing campaign. Many businesses around the country have already partnered with their local public health departments. Here's what these business leaders have to say about the importance of becoming closed dispensing sites.
Well, the company needs to take care of their people so we can continue to operate. So the more ready we are, the better we can stay in business. So if we have opportunity to protect our employees in the facility while something's happening outside, we should do that.
I think it's important for us as an organization to be there for our members, for our family physicians who are practicing throughout the community, and that means we need to keep our business going. That means we need to keep our doors open and keep the resources available.
The benefit to Black & Veatch and professionals that are members of the Black & Veatch family is that we can better look out for the welfare of our professionals and potentially their families in the event of a major health emergency.
So Schwab values are very, very important to us, and it's 3 in a row, really. It's our employees. You know, the safety of our employees is up there with the brand. The Schwab name is very, very important. Protecting the brand is critical to us, along with the assets of our customers. Our customers are very important to us, and we treat them like family. So it's employees, brand, the assets of our customer. Any way you want to turn that around, it's still the number 1 in 3 parts. So whatever we can do to protect those 3 entities, we're going to do it.
Specifically in our case, if we have a health crisis, a mass health crisis, we're going to have more work to do as an insurance company, not less. So we need to make sure that we can take care of our employees and therefore they can continue to work and keep the system going.
It's an opportunity to provide a service to your employees, and not only will it save your employees, It may improve your public relations. You know, it's an opportunity waiting to be used. You know, there's just not a downside to it.
By working with Orange County Health, we're going to help relieve some of the pressure that they would have. Our employees will benefit because we'll be able to give them the medication they need. Orange County is going to benefit because we're taking some of the strain off the public pods that they have out there.
Business has a lot of resources, a lot of experience, a lot of smart people, and there's got to be ways that business and government can work better for Homeland Security.
If you are ready to receive more information about how to become a closed dispensing site, contact your local public health department. Remember, in a public health emergency, your employees will depend on you for guidance and information. The sooner you can mitigate their concerns and provide medication that will keep them healthy, the sooner you can get your business back up and running. It's good for your employees, it's good for your business, it's good for your community.